action.
Good morning, sir. I'm Rosalie Misa, performing wound care dressing. First, check the medical order to the care of wound care. For the nursing plan, care related to the wound care. Prepare all the materials. Identify the different types of the wound. We have brush injury, amputation, fracture, abrasion, laceration, types of wounds, bed ulcer, burn, surgical wound. Next.
So sorry, let me just, since you've already mentioned that, let me just highlight later. Okay, so I'll let you continue, then I'll talk to you later about the different types of wounds. We're gonna dive into those different types of wounds and I'll show you pictures later. Okay, so just continue with the preparing of materials.
Prepare all the materials. You have clean gloves, biohazard bag, surgical tape, measuring device, sterile gloves, gowns, hairnet, sterile dust. Perform hand hygiene.
Wala kang ano. So this is time and energy.
Principles of time.
Oh, see? Oh, yes. Oh, yes. Shortcut.
Identify the patient. Hi, sir. Good morning. I'm Rosalie Misa, your nursing assistant. May I know your name and birth date? Can I check your ID or birth date?
And then,
Close the door and curtain for patient privacy
mm-hmm.
and making your patient comfortable.
Okay.
Ask the patient if have pain. Evaluate the pain. 1 is no pain, 10 is severe pain.
Mm-hmm.
If the patient said no, proceed the procedure. If the patient said yes, I will assist the patient. Ask the doctor before procedure. Give the procedure. And give the intermittent analgesic medication. Allow the analgesic for 30 minutes. Place the body inside bag. Adjust the bed for to comfortable working height, usually elbow height or of the caregiver. To make sure the proper medicine and mechanics for the procedure. Assist the patient to comfortable position that provide easy access to wound area. Use bath blanket.
Yes. So, so now let's pretend that there's a patient here, right? And then this is what they call the sheet. Huh?
Bottom sheet?
Oh, very good. Ang bottom sheet, di ba nasa bottom?
Ah,
So what is this?
top sheet.
Very good, top sheet. So, you have to, how do you put mga bath blanket, diba? You have to roll, you have to put this one first, and the patients. You have to put them bath blanket for what? What is a bath blanket for?
Sir, walang may iba na pang click.
Meron. Oh, how does this work, sir? Hindi mo ba ito?
I-insert lang siya sa laptop, so.
Ay, parang Bluetooth.
Ah.
Tapos magagano-gano mo
Ayun.
yung ano. Saan nabibili yan?
Sa Amazon, sir.
Anong tawag siya, sir?
Laptop, clicker, parang ganun.
Clicker?
Click.
Clicker. Okay, thank you.
Okay, sir. Thank you, sir.
Thank you. Okay, so now you have to put the bath blanket on and then you have to fold and roll the top sheet. Why do you have to roll and fold the top sheet? In this process, you're doing the wound care, right? So why do you remove the top sheet? Why?
Leak, sir.
To prevent that?
Hindi siya matuwa.
Huwag mo ipakita, di ba? You have to provide privacy to the client, right? Roll as you fold. Okay? And put it here on the foot part because later, after you finish everything, then you have to put it back on for the patient, right? So, let's pretend na the problematic area is the legs, for example, right? So only expose the area that needs to be cleansed or what parang mag-dress. Okay, so let's pretend na this side. So now you have the legs exposed. Okay? Gusto mo two legs? Siyempre, kung two legs, edi one leg muna ang ilalabas, tapos kayo.
Isa na lang.
Nagmamadali.
Okay na.
Assist the patient to the comfortable position that provides access to wound area. Use the bath blanket to cover an exposed area and under the
And then,
check the color and assess the wound. Check the color.
you assess the wound, okay? So what are we looking in the wounds? Ano ba yung mga characteristics of the wounds?
Color.
The color, okay? So you have to identify the color if it's red ba, if it's blue. Kasi pag blue meaning it's what? Pag red, siguro probably it's fresh. If it's yellow, what does that mean? So there's a pus or purulent. Can I say purulent? So there's a pus. What do you mean? If there's a pus, what does that mean?
Infected.
Infected, right? So if it's red or there's a bloody red, so fresh blood, or maybe not so fresh blood, like the, ano na, or maybe it's already brown or black. What does that mean? Pag nag-brown na ang wound or black. Pagaling na ba ang black?
Activity.
It's gangrene, gangrene. Kasi gangrene?
Gangrene.
Gangrene meaning na na-dry up na siya, probably not healing na. So namatay na siya ba?
Yung veins.
Okay? So what else are the characteristics? So how about let's talk about the area of the wound. So, how do you know if the wound is healing normally or if it's infected? Let's talk about infection muna. What are the common signs and symptoms of wounds with infection?
Swelling.
So there's inflammation, right? What else?
Pus.
There's pus. What else? Is there pain?
Yes.
Very painful.
It's painful. Okay, and what
The
else?
color.
The color is
Red.
red. So that's the peri wound. Can you say peri wound?
Peri wound.
It's when you say peri, it's the area around the wound. So basically, what she's trying to say is that you have to assess everything about the wound. So for example, the dressing, right? So there's a dressing, and then obviously the dressing has parang ano na siya mga discharges. So tingnan mo din yung dressing. How many dressings? How many gauze did you put? Is it full of blood? Is there no blood? Is there pus? So yung lahat ng yun, you have to identify and also assess. Okay, next.
Check the how it the how it beats measurement,
The size.
the size of the wound.
Pwede ka naman.
Wala.
Kinuha na siya ng koligo. Not allowed.
Di ba sir, study pwede naman.
Check the wound.
Mag-cut ka na ng tape. Cut ka ng tape. 4 pieces. So let's pretend that this is the legs of your patient, okay? What is this?
The
The
leg.
leg.
Okay. Very good.
Tatawin.
And then, ba't yung brown makita?
Sorry.
And then, so let's just identify this one first, okay? So I would really encourage my students to have your own set of first aid kits because again, you'll never know when you need it. So especially if we're gonna go outside the country now, so as much as possible, try to encourage your boss or your patient to have their own set of this, right? So what is this? What do you call this one?
Cotton buds.
Ito,
Because
this is cotton swabs or buds sa Philippines. It's more commonly known as, but this one is Q-tips. Q-tips is like longer version of the stick, and then you have the cotton ball on the edge or the other tip. Okay, Q-tips na siya. What is this one?
Gauze.
What is this one?
Gauze.
Gauze, right? And gauze, it comes in different sizes. This one is 4x4. Okay, what is this? So you have band-aid or plaster. So you have your tape or microphore. Okay, ang tawag mo?
Microporte.
Microphore? Microphore.
Micro.
4 or 4? 4. So you have also different types of gauze or bandages. So this one is a roll, okay, cotton roll or roll bandages. What else? So you have this betadine. What is the generic name of betadine? Pitbull.
No.
No.
Providone iodine. So it's here. This brand name is called Lurcon. In the Philippines, it's most commonly known as betadine. Okay. In America, it's called betadine. Okay. What else? I think that's what we have. Asan mo na tape mo? Okay. So, can I open one of this? Or meron ka na ba extra doon? Okay. So, let's pretend that this is the dressing, okay? Alright. So, first of all, are the CNAs allowed to do wound care
Yes.
to begin with?
Yes.
Ikaw, what do you think? Yes. Uy, yes or no?
Yes.
Iba-iba lang tayo, hindi kayo sumasagot.
Yes, sir.
No.
Huh?
So, remember, what do you think? Yes or no?
The doctor,
When is it yes and when is it no?
yes, if the doctor assist to clean the wound.
If the doctor what?
If the doctor allow you to
If the doctor does not allow you, then no. If the doctor allows you, then yes. Very good. So what does the law state, okay? So just so that you know, guys, wound care is actually not intended for CNAs, okay? Especially if the wounds are fresh. So when is the wound fresh?
If it's red.
No. Anong situation na bago pa yung
After the
sugat? After
accident.
that? After the accident or maybe after the surgery, right? Or amputations, whatever. So in that cases, if it's really fresh pa, you are not allowed to do wound care, okay? When are we gonna be allowed to do wound care? So technically, nurses or CNAs are only allowed to do wound care if it's already routinary, okay? Ibig sabihin sa routinary, the wound is healing, yung healing is normal process. So I mean, it's about to be healed, and then you're just doing this for hygiene purposes or routinary purposes na lang. So maybe when the patient's already discharged and is going home na, so while at home, obviously you will be the one to take care of that, right? But for the sutures or yung mga tahi-tahi, who will take care of that?
Doctor.
Or the nurse, excuse me. Okay, there.
But in a hospital setting, so there is less chances that we will do the wound care.
Check. So I'm showing this, we're telling you this so that we also have an idea how to do wound care, because who will be assisting the patient, the nurses or the doctors? It's us, right? So you should know the process and you should know what to give next, or ano kailangan ma-anticipate mo, ano mga kailangan ng mga doctors or nurses. Alright? So there. Next. Ano nang next? Let's talk about this one. Ito may mga colors siya. Did you research about this? What color do you have now for your garbage bag or yung disposals?
For yellow.
Yellow, very good! Bakit yellow? Is yellow your favorite color?
The yellow is for the infection.
Infected waste.
Ha?
The infection.
Infected waste.
So ano yung yellow for? Infections or mga waste or yung mga body parts that have been amputated. So basically, if you see a yellow garbage bag, it's a parang caution for us not to touch it with your bare hands because there are infectious elements there, right? So now, why are we using yellow? Ano bang at risk for this?
For the cleaning of the wounds.
So ano meron sa wounds? Bakit kailangan yellow?
The wound is infected.
Wala dyan ang sabon. Bakit? Bakit yellow?
Yan yung ano, specific na lagay.
Para saan ba yung yellow, Tagalog?
Waste is the for the
Waste na, wag ganun waste. Tagalog na. Anong klaseng basura ang nandyan sa yellow?
Non-biodegradable.
Ano ibig sabihin ng mga non-biodegradable? Hindi na
Nabubulok.
nabubulok. Ano to, community tayo? Nabubulok. Recyclable.
May mga blood, sir.
May mga blood involved pa tayo dito?
Yeah.
Are we dealing with blood sa wound
Yes.
care?
Yes.
Oh yes, ako yung yellow. Okay, next. Para saan naman ang green? Or black? Sino dito naman, who have an idea?
General waste.
General waste, sometimes kay black ang general waste, right? How about the red?
Blood?
Red.
Old syringe and plasma for the material.
Di ba yung nakalagay dito?
So,
Di ba? Ikaw din, hindi mo ba makita? Very good. And how about the yellow one, the white and the blue?
sharp needles and cut glasses.
So the bottom line here, guys, is that in every hospital or in every community, there's always waste management disposal, right? So regardless of the color, you have to be oriented of how the waste management is done in their hospital, in that hospital. So you just have to follow the protocol, okay? That's it. Next.
Adjust the bed for comfortable working height.
Oo. At what level man i-adjust ang bed?
Usually in elbow.
Elbow
The-
level. Okay, okay, game.
Carefully remove the soil dressing. If any part of dressing stick on the underlying skin, use the small amount of the sterile saline to help loosen and remove. Do not reach owner the wound.
Hmm.
For easy to remove, making sure the patient is not moving to the right.
Okay, next. Tanggalin mo na daw yung... Yan.
It's okay po.
Huwag mo na lagyan. Masisira.
Written. Remove.
Sige nga, ano mga characteristics ng wound mo? Ano nakita mo sa wound niya?
Redness eh.
Oh, then... Ano pa? Ikaw, ano nakita mo sa sugat niya?
Healing now.
Oh, ikaw.
It's dry.
Okay.
Clean the wounds.
Color, ano nakita mo sa color niya?
It depends if it is healing. It's
Walang depende dito. Pumili ka lang ng sarili mong kwento.
red.
Red, ikaw.
Brown.
Okay. Okay, game. And then?
Bleed naman sir.
Number 14, inspect mo the wounds daw. Appearance and drainage. Check if there's any pain. Check the sutures. What is a suture?
Tahi.
Tahi, strips, staples, or tubes. Using sterile technique, prepare a sterile work area and open the supplies. So this is your dressing set. Okay, what is in your dressing set? Basa.
Hard blister tray. Cotton balls ball.
Okay, makita mo sa kanila as you read.
Hard blister tray.
So look at the tray. What do you observe about the tray?
Divider.
Do you have divider? Yes. Para saan ba itong mga, you have 1, 2, 3. Para saan to? What is that for?
Pulling na dito sir. Yes, sir.
Ako, nagagayad ako magtanong ka para i-share mo sa kanila. Alam ko ang sagot. I-share mo sa kanila ang sagot. Why?
Separate each materials.
Pouring saline.
What is a line?
Normal's 9. Normal's 9.
Yeah, what is a line?
For what? Wash the wounds.
Okay. Ano ba yung saline? Made up of what ba ang saline?
Distilled water.
No, distilled water and saline, normal saline is different.
Ang distilled water is just water. Ang normal saline, so that's normal sodium chloride. So it's basically salt or asin. Okay? So ilalagay mo siya dito for cleaning later. And also if you put, ano nga yung betadine, ano nga yung generic name, generic name ng betadine?
Povidone iodine.
Kayo dyan. Akin na nga yan. Hindi talaga tayo titigil hanggang hindi kayo nagpa-participate. Oh. Ano yan? Basa.
Lurcon.
Okay, that's the brand name. What is the generic name?
Skin and
Povidone.
I cannot-
Iodine.
iodine. Povidone.
So, are we allowed to also use that in the hospital?
No.
Huh? Why not?
Because we have supply, right?
So,
We go to the
They have supply, so we are not allowed. Pag walang supply, allowed.
Because they're just using the normal saline in the hospital to disinfect the wound.
Ikaw.
We can use it.
Why can you use? What if I'm allergic? So who will tell you if you're allowed to use or not?
We have
The patient.
So the patient naman, gusto ko na dito natin kasi yes, a time.
Sir, because you need to ask if he has
If
allergy.
doctor allow us.
Very good, kudos. It should be the doctor that's telling you what to use and what not to use because
Is it
you're in
not
the
written in the
hospital.
notes?
Yes.
At the start of the
Yes.
procedure, you have to read the notes, right?
Yes. So either aguoxinada, hydrogen peroxide, or betadine or betadine, everything should be as per the doctor's order. That's why number one step is to, I guess, read the
doctor's
medical order, right? So you would know in the medical order what is allowed, what is not allowed, what is he allergic to, and blah blah blah. Okay? So now using sterile technique, prepare your sterile work area and open the supply. We're not done yet. So number one, what is this? Yung tray. Number two,
Cotton wool.
cotton what?
Cotton wool. Cotton wool balls.
Cotton wool ball.
Wool.
Cotton balls. Okay, so you have sets of cotton balls. Next.
Non-woven swab.
What?
Non-woven swab.
Oh, swabs. Asa ba yung swabs mo? Ito. What else? Next.
Waterproof tray.
So you have your drapes. Para saan naman yung waterproof drapes? To prevent, ha?
That are sterile disposal. To put
Are you ba yun? Are you asking me? Next.
limpet bag.
What's nga bag? Limpet bag, okay? And then hand towels, and then you have your scissors. What do you call this one? Clip, very good.
No, it's forceps.
Forceps.
Dissecting forceps.
Okay, or forceps, okay? So why do you have two forceps?
Not for the cotton.
Dry and
The gas.
Hindi yung gas, ang tawag dun kay
Gauze.
gauze. Ano yung gas? Ulo ang... ano naman ang ghost?
Multo.
O, nakakatakot yun. Okay, game. So you prepare na your sterile technique. Sterile field or sterile area. Wrong. So, itong drape na to is, the drape is used to have a sterile area dun sa wound area. So ito, hindi mo siya lagayan. Lagay mo lang siya dito. Okay, lahat ng yan, lagay mo lang siya dito. Actually guys, this comes in a package. Para siyang may newspaper na ganyan.
Yeah.
Okay? Para naka-cover siya ng ganyan. And then, you have to carefully open this like that. Open the other side, open the other side, and then open the other side. That will be your sterile field for this, and not this one, okay? So, now you have your drapes here. Okay. So, this one is usually naka-fold. And then, there's also dapat gloves here as well. So, she already used the gloves, right? Okay, now, you get the drapes, and then put it there. Careful not to unsterile it or not to make it dirty. Okay? Sige, cover mo yun doon. I-cover mo dito. Saan ba yung wound niya? Nandun na ba yung wound niya? So, i-cover mo yan siya dyan. Dyan mo ilalagay para even if mag-touch ka dito, it's still your area is still clean, right? Okay? So, if you have to put something else, then you put your forceps, mga ganyan, dito mo lang siya ilagay para clean pa din siya kahit papaano. Okay? Next. Okay?
Change the gloves.
Yung maghugas ako ng paa.
Ano? Ha?
And actual. Yung maghugas ang paa ko.
Kudus.
Gloves, sterile gloves.
And then you have to put na your itong saline solution dito, okay? So guys, if you have a bigger saline solution, you have to also put a note kung when did you open that saline solution because it's only okay for the next 24 hours. You have to consume it in the next 24 hours, otherwise it will become expired or unsterile na siya, okay? So you have to put them, you have to open this, and then you have to put it here, and then you have to be ready now with your stuff. So now you have to change your gloves to sterile gloves. Do you know how to put on a sterile gloves? Where's your sterile gloves? Wala? Oh, pretend na lang tayo ng sterile gloves. So, can you give me another pair? Ikaw din, gumawa ka din. And then usually the sterile gloves, diba have you seen a sterile gloves? Yung nakalagay sa ano? I should be able to teach you this during the PPE demonstration. Usually, pag open mo ng package, it looks like that, okay? And the thumb is outside, like that. Another one is like this, and the thumb is also outside. So the logic is, you have to do skin to skin and gloves to gloves, okay? So when you open your package, you'd see like this, the right and the left, right? So if it's going to be like that, then you just have to move it around so that it will face you like properly, okay? Now next, please. Yun. Okay. Next is, you have to do like this, okay? You have to start with your dominant hand. What is your dominant hand? Ha? Ang dominant hand mo?
Right.
Okay, so you pick the other gloves and then like that, and then make sure your hands are like this, especially if you have big hands. Don't do like that because it will be difficult for you to insert, right? So like this, and then okay. Now, don't worry if you cannot insert everything properly just yet. Okay? So, this is skin and this is skin. Now, this outside is your gloves. So, gloves to gloves and skin to skin. Okay? So, after this, you have to use the gloves to gloves. So, insert mo inside itong gloves na to. Okay? So, it looks like that. Alright? And then, do like this also. And then, insert mo na yung mga dapat ipang-insert. So normally in this case, you should not be wearing yung watch. So now you have your gloves and then the gloves. Since you're already sterile, then you have to fix na yourself accordingly. Okay. So careful that you will not touch any of the unsterile field with your sterile gloves. Okay, next. Next one.
Clean the wounds. Clean the wounds. You should be. Agas, agus.
Goose? Ano ba talaga? Gas? Goose? Geese? Ano bang goose? Anong goose?
Gospad.
No, ano yung goose?
Itik.
Ang geese?
Madaming itik.
Yes. So ano dapat, ano ba ito magbasa? Say goes.
Goes.
Go.
Goes.
Okay.
As in, take goes. Dip in the saline. Clean the wound from up to down.
No, that's not how you do it. So, you get this one, okay? And then, gamitin mo siya, then you have to make a flower.
Oh.
Oh, alam mo naman pala. Sure.
Take the gas pipe and dip in the saline. And you need to remove the excess water.
Water.
So you take the gauze and then you create parang a flower, okay? So what you need to do is just, yung mga points na to, i-mimit mo lang sila sa gitna. So gagawa ka ng parang balls, okay? And then this one, you have to dip in the, what is this?
Salam.
Saline solution, okay? And then keep the other forceps sterile and the other forceps unsterile. So I will use my right hand as my sterile hand and my left hand will touch the unsterile part. This one is unsterile, this one is
Sterile.
sterile, okay? So I will use this and then, oh, you clean down. And then discard, and then do another one na flower. So if you notice, this hand is sterile or unsterile? Unsterile, right? So use that hand lang to make your So what will you do to save your time and energy? So even beforehand, you know that you'll be using around 4 gauzes. Then you have to prepare it na lang 4 gauzes na flower, right? And then you can dip it already in the saline solution so while you wait. So yun, tapos itatanggalin mo lang yung excess na water para hindi ka na paulit-ulit. Okay? Okay, now, next. Diba this one is sterile, right? And keep it to yourself, yeah.
Clean up to down.
So how do you clean a wound? Kunyari ito yung wound ko, okay? Yan yung wound ko pa ganun. So how do you clean the wound? Sige nga. Show mo sa kanila. Oh. So from?
Top to down.
And then discard. Next.
Get
Huwag na paulit-ulit. Matatagalan tayo masyado. Okay. O next. Ipakita mo lang kung paano.
Ayan, top to then discard.
Okay, and then? Isang beses lang?
3 times.
3 times? Ilan times?
Kung gano'n po kasi.
O ganun.
Up to down.
Okay.
Discard. Up to down. Clean on the surface.
So where do I start? In the middle, in the side, going inside, or from the middle, going outside?
From inside to outside.
No, what I mean is if this is your wound, for example, right? So now this is your entire wound. Where do you start? From the middle, going outside, or from the outside, going inside?
From the middle going outside.
From the center, going outside, right? So one stroke. Okay, so one stroke in the middle, from top to bottom, and then
Discard.
say discard.
Discard.
Yes, get another one, and then from the side naman, and then discard. Get another one, the other side, discard. Get another one, discard. Okay, get another one, discard. Okay, if it's necessary, if kailangan mo siyang ipasok pa dun sa loob kasi there's still mga bacteria inside, right? So, if kailangan mo pa siyang ipasok dun sa loob, ipasok mo dun kaya para malinis talaga siya, discard, okay? And then this one na naman, is this painful?
Yes,
Yes,
yes.
painful.
Discard, right? So that's why, what did she say about the pain? If the patient's feeling the pain, what should you give?
And I'll just say,
As per doctor's
Order.
order, dapat, okay? And then, discard. So now, your wound is already clean. What's next?
Apply the dressing.
Once the wound is clean, dry the area using the gauze sponges in the same manner. Apply ointment or any other treatment if ordered. And then, 20. What is 20? Read, Emilu. Nasa 20 na kami, nasa puro ka pa lang.
Apply
Apply a
any
layer of rice sterile
Sterile.
dressing over the wound. Or it may be used to apply the dressing.
Yes.
Okay.
Dry dressing.
Next.
21. Place a second layer of gauze over the wound.
So for example, you have this wound, maglagay ka muna ng how big is the gauze na dapat gagamitin?
It depends on it depends.
Does it depend on the size?
Size
Yeah.
Right, so if you have a bigger one, then you need a bigger size of gauze, right? So pretending this is just a small size of wound, so you have to put this one here. You have to put ointment if it's necessary, or mga spray or whatsoever. And then you have to put it there, and then you have to put one bigger, this one, okay? Okay, basa, next, Dian.
Apply the surgical part or
Oh, yun na yun. So, smaller, then you have the bigger. And then, remove and discard the sterile gloves and secure the dressing. Label the dressing with the date, remove all remaining equipment, and then evaluation. So, you have to do the aftercare. Can you say aftercare?
Aftercare.
where is it close?
So, okay now you have to, do you understand?
Sir, label the dressing with the date. Ano yan with markers? Susulatan mo yun.
Yes. So, normally kasi they put kung kailan sila na last na dress so that they would know when ang next na.
So, yung mismo ano, yung sa...
Yun, di ba maglalagay kayo ng tape?
Ah,
So, pwede
okay.
ilagay dun sa may tape there. Okay. So, ibalik mo yan lahat, ayusin mo, tapos ibigay mo sa akin. Can you turn it off? Ay, huwag na lang pala, kasi I will discuss to you about the different types of wounds. Okay? Now, what is a wound? Ano ba yung wound?
Sugat.
Sugat. Ano yung mga iba't ibang uri ng sugat at ginawa?
Surgery.
Injury. Surgery, injury.
Burn.
Burn.
Ano pa? Basta yung mga ano pa yung nakadlugusunod dyan.
Amputation.
Amputation. Fracture.
Anong amputation?
Cut.
Putol lang.
Kaputol.
Putol lang ba? Ay, hindi atakbo.
Rose, next, bansa.
Crush injury. Laceration.
What is laceration?
Cut. Cut sa breasting.
What is laceration in Tagalog?
Hindi ko tanong.
Mahiwa.
Sinulat ka.
Mahiwa. Mahiwa.
Ano pa? Ano pa iba dyan?
Abrasion.
Abrasion.
Ano sa Tagalog? What is Tagalog abrasion?
Ang dito mga
Tagalog!
natanggal ang balat. Natukla.
Nabalatan.
Tutuklap.
Natukla.
Nalaksi.
Next!
Burn.
Tagalog.
Napasok.
Nalap.
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 Okay, ano pa?
Bensor.
Tagalog.
Sugat sobrang paghiga.
Sobrang
Hindi na ito pa yung mga.
Signal.
Ano may laptop ko? Anyway, let's start with incision. Incision is actually a clean wound. Okay? In Tagalog, it is na hiwa. What are instruments that could make you a clean cut? What kind of situation or what kind of items can like make a hiwa?
Scalpel.
What is a scalpel?
Used to operate for surgery.
So is it sharp?
Yes, it is.
It's sharp. So what else can make you a clean cut?
Paper cut.
Paper cut, yes. What else?
Knife.
Knife should be sharp. The knife. If I do like this a sharp a knife, what will happen to the wound? What type of wound is that?
Laceration.
Laceration.
Right. Ang tanong ko, ano yung pwede makapagpapa-wound sa inyo ng sharp, na matulis, na straight cut, na malinis? Sabi mo scalpel, correct. Sabi niya knife, correct. Ano pang iba? What else?
Cutter.
What? Cutter, very good. What else?
Foil.
Pag hindi makasagot, gagamitan ko ng scalpel. What else?
Yung
Diana.
foil set.
Patago-tago pa
Needle.
kasi alam mo, hindi ko nakikita.
Foil set. Needle.
Needle.
Foil set.
Sabi niya,
Ox. Murderer.
they,
Blade, very good. Ikaw na lang, Marian.
ang buena, crush lang.
When you stick the glass.
Very good. Yung mga sharp na glass. What else, Marian?
Nail too. Nail.
Sorry.
Blade? Done with the blade.
Yes, done with the blade. Next. Wala na. O, di wala na. Next, let's talk about laceration. Ano ulit yung incision? Diyan? Oy, off mamaya. Ay, ko na yung dito sa laptop. Pati laptop hindi nag-o-open. Hindi nga nag-on. Ayun. Ano nga yung incision na yan?
Incision? Yung...
Sharp, straight bone.
Sige ka na lang. Ano na yan sa'yo?
Sharp, straight bone. Incision.
Tagalog.
Yung hiwas straight.
Malinis na pagkahiwa, right? Ano what are the examples of mga nakakakos ng incision? Scalpel, blade, knife,
glass.
Glass na sharp, ano pa yung sabi niya?
Paper plate. Oh no, paper cup.
Paper cut, paper plate, nakakalusog yun. So that is incision. Number 2 is laceration. Laceration, what is laceration, Basa?
Irregular cut from the area.
Irregular, Tagalog. Malinis, hindi malinis na pagkasugat. Hindi malinis na pagkasugat, basta nasugatan ka. What would cause you irregular cuts or wounds?
Tumama kasi sa sharp object.
So sharp na object ba? Kung sharp yun, hindi incision yun.
No, like... You step the nail.
Ninil, hindi naman ikaw natusok, di ba? Ano sabi niya? Irregular na cut. So ano yun? What is laceration, bros?
Deep cut.
Maraming yung sugat.
Like
accident. Hanggang makita yun. Like car accident.
For example, sir, sa construction site,
Okay.
nasugatan yung worker. So, yung hindi siya ano,
What if nabagsak ka ng machine?
ano,
Broken bones. How do you categorize that?
Broken bones, hindi na yan wounds, di ba? Fracture.
ano,
Ang pinag-usapan ng sugat.
natusok ng pala. Nadali ng pala
The tusok is not part of our discussion. Sugat kasi pinag-uusapan natin. Pag natusok ka, that's a different type. Guys, laceration is just the opposite of incision. What is incision again?
Clean ka.
Clean cut. What is laceration?
Unclean ka.
Unclean cut, not clean cut, not caused by sharp object, caused by dull or blunt objects. So what could cause blunt objects? Kunyari, gagawin kita ng bote ngayon sa ulo mo. Ano mangyayari sa'yo?
So bleeding.
Bleeding ka. Malinis bang bleeding? Hindi malinis. Ang wounds.
No.
Not nice, right? Okay, what if naman I'll use knife na hindi sharp? Blunt na knife, yung bread na knife. If I'll do like this, ano mangyayari sa'yo? Bread knife, diba? This is not sharp. How about scissors na hindi sharp?
Yung rusty.
Rusty knife.
Hmm.
Yeah, like that.
Basa.
Warning, the following agent or UWB is either related to some viewers discretion is strongly advised.
Ayun.
Okay, what is a wound?
Research in a community or organization that is followed respiration or that would heal.
So these are the different factors that may affect wound healing, okay? Either nagpapatagal sila ng paghilom ng sugat. Okay, the example of diabetes. How is diabetes affecting wound healing?
Hindi.
Matagal silang gumaling. Bakit nga gumaling?
Because of the sugar.
Tapos na-lessen na yung oxygenation, right? Infection, can it also cause the delay in healing? Obviously, right? So there's a process of bacteria. There are drugs or medicine that could also cause healing na matagal. Nutritional status, if you are unhealthy or malnourished, what do you think would happen to your wounds?
Become worse.
It could become worse or maybe it will not heal properly, okay? Then oxygenation is also important. Di ba oxygen can help you in curing and ganun, healing and everything. Okay. Number 1, laceration. What is laceration in Tagalog?
Napilas.
Ano bang mga dahilan yan?
Na-bump.
Na-bump.
Nabang na
Yeah.
Accident.
Accident.
Ano pa?
Car crash.
Ha?
Accident.
Are you making a video?
Yes.
Is it on?
Yeah.
Yeah.
Oh, don't make a video. Listen to me.
Okay.
Sinuntok sa mukha.
Tapos, nasunod ka
Basag yung
na
mukha.
Labi mo, putok ang labi.
Oo, tama. So, is this a clean cut?
No.
Ha? So, di ba ganun siya? So, it's not clean cut. Okay? Laceration in Tagalog is?
Napilas.
Very good. Laceration na pila. So, this is the most common area of laceration. Maybe this is a bite of an animal or a dog, yung nakaganon ka. Or maybe nasabit ka sa mga wire. Ano kaya to? Siguro this is an accident, right? Next is your incision. What is that one?
Nahiwa.
Clean cut.
Scalpel.
This is a scalpel. Okay, can you tell me about the scalpel? What do you know about the scalpel? Is this disposable?
No. Each doctor has their own scalpel,
Okay.
their name, the license,
Huh?
the doctor is in the
Then, what is disposable there?
Oh.
the whole.
The holder is non-disposable. So, that one, ano ba yung sharp object na nasa tape niya?
Blade.
Ang blade ba disposable?
No.
Hindi.
Disposable.
Pwede ko bang gamitin ang blade mo sa blade sa akin?
No.
So, it is disposable. Parang yung nasa barber, di ba, once they
Yeah.
use one blade, they have to dispose it. Pero the handle itself, okay, non-disposable sila kasi mahal yun. Okay, is it clean?
Yes.
Tagalog?
Nahiwa na punit.
Okay. Now, what is this? Incision or laceration?
Incision.
Why?
Because it's clean cut.
This one.
Laceration.
Why?
Unclean cut.
Yes, between the two, which one would heal faster?
The clean cut.
The clean cut.
The
Clean cut.
incision. So, what if I gagano mo kayo ng bote sa ulo niya? I will hit you with a bottle of wine on your head. What is that? Laceration, incision.
Laceration.
What if I'll get the piece of glass and then I'll slash off my neck?
Incision.
Why is it laceration?
Because the glass is not same.
Glass is not clean.
Why is it incision?
Oh, incision.
Imagine mo nga, Emelu, sharp na glass.
Sharp
Gagano ko yung pagmumukha mo. So, ano mangyayari sa mukha mo? Mag-clean cut or not clean?
Clean cut.
So, what is that?
Incision.
Ah. Ang laceration is hindi clean. Ang clean, incision, na incise ka. So, ulitin yung tanong, pag gagawin mo yung mukha mo. Ano yan? Incision, laceration.
Incision.
Ha? Bakit?
Because it's
Because,
Clean cut.
it's clean cut.
very good. Next is abrasion, Tagalog.
Nagasgas.
When are you be
Nadapa.
nadapa or you fall? What else?
Or you go for cycling.
Okay, you're bicycling and then natumba ka. What else?
When you're running.
When you're running and then you slip and then you fall. What else?
Fell down.
Someone fall. Someone fell.
Oh, ano sa semento ka? Oh, yun. Is it painful?
Yeah.
Yes.
Why?
Because
The
it's
scrub.
bleeding.
There's a scrub, scrape skin.
Friction.
What is in your skin
Kasi
makes
biglaan
it
siya.
painful?
The outer skin.
So
The
pag
tissue.
dahan-dahan kitang gaganingin, hindi masakit. Happy. No, because we have a lot of nerve endings in our skin. Diba? What layer of skin is na, ano, dito next?
Epidermis.
Ah, dermis layer, lalo na sa dermis layer. Our skin is actually very sensitive, right? It can feel cold, pain, hot, mga ganyan. So if it's scraped off or nagasgas or tawag din sa abrasion, ang nerve endings is activated. That's why it's really mahapde and painful. Okay. What do your parents do when you fall and then you have abrasion? Marising. Napaka-evil ng parents.
Kata-kata ako, nandun daw nadapa.
Babaluin.
Basa, read,
Concussion.
Tagalog.
Nabugbog.
When do you have or when do you experience yung pagkakaroon ng contusions?
When we have a period, we always...
So during menstrual period,
Yeah.
When you fight
Masuntog.
when you find, right? Okay.
You mostly...
Okay. Now,
menstruation.
there are instances, like for example, for her, in her case, that during her menstrual period or during that period, that she experienced nabugbog or yung mga contusions without a reason, right?
What's it?
So because it's normal, it's hormonal, right?
Oh.
Because it involves bleeding and everything. But beyond the time frame of during your menstruation and then you are still experiencing contusions, is it normal?
No.
Leukemia na.
Ay, doctor ka ba? Para
There's something wrong in your blood.
So, something is definitely wrong, right? So what do you do? What do you advise your patient?
Go
See the doctor.
Yeah.
Okay, ma'am, leukemia na yan. Ano nga pala si Dr. Maria Ila?
Normal na.
What if naman physically you were hurt, okay, and then somebody punched you, maybe your patient or something abused you. So is it a good time to go to the authority or
Yes,
to the
of course.
police?
Yes.
Why?
Medical record.
So you believe that if you have black eye, it's the best time for you to go to the police
Yes.
rather than wait for that to subside? What's your opinion on that?
Right away.
No, right away after the
Incident.
incident.
Correct. I agree with all of you because the evidence it's hard evidence, right?
Yeah.
It's a
And
hard
already-
fact. Now, what happens if, for example, you were afraid and then maybe they are threatening you that if you go to the police, I'll kill you or something like
Yeah.
that?
No, no.
So and then you let it subside first, and then you go to the hospital and realize to the police that, oh no, I have to tell the police now. So where is your evidence now, right? So your case is already weak, right?
Yes.
So God forbid if something happens to you, like in this case, and then hopefully not, okay? But if it happens, then it's the best time for you to go to the police. Alright.
Police before the hospital. No.
Bahala ka na sa buhay mo, paano tayo. But normally guys, if you go to the hospital for abuse, they also ask
Medical.
police to go there. Or medical legal, right?
And then better to go to the hospital.
Hospital, they will call to the police.
They will call the police, no need for
Right.
you to go
Anyway, you have to
places.
make a statement and everything is already written in the medical records,
Yes.
medical reports. For rape, for abuse, mga ganyan. So somebody will help you on a legal matter. Okay. Even if you're in an accident and if you go directly to the hospital, police or medical legal will also be there to assist you if you want to file a complaint or things. Okay, cool. Avulsion. Avulsion is Tagalog.
Kasambugan.
Can you give me an example of your body parts that could be mahiwalay from your body?
Finger.
Finger. You.
Leg.
Paa.
Yes.
Kamay.
Yes.
Leg.
What would,
Teki ka na.
any part of your body that could be
Remove.
removed or
But
sliced?
still alive. Ears. Ear lang.
Fingers. Yes.
Yeah. Tone.
Toes.
Nose.
Knees.
Because I'm leg.
Toes, knees, and shoulder.
Okay, let's see this one. What is this?
Oh no, finger.
What could be the cause of this? Maybe chainsaw, maybe accidents,
Yeah.
maybe in the kitchen. How about this one? What could be the cause of this?
Accident.
Sabog.
Fireworks.
Fireworks.
Or maybe an accident. How about this one?
Oh no, wait, it's a name?
Yes.
Pedicure.
Oo, pedicure or something. Siguro na ganun ka. Okay, what about this one?
Murder.
Ha?
Murder.
What's that?
Murder. What is murder here?
Ano yun, sir?
Ano ko? Tingnan niyo.
Dila?
No.
No, it's a apple.
Thumb. Ganyan ba yung itsura ng
No, it's
thumb
not
mo?
Egg, parang egg man siya.
Ah! Penis!
Penis, egg. Penis, egg.
Egg.
Yeah.
What do you call that in medical
Balls.
terms? Balls.
Oh.
Oh, anong tawag mo sa medical niya? Tapos na tayo sa human anatomy. Okay, this is the penis and this is the egg. Now, if this is the egg, where's the chicken? Oh,
Oh, yeah, it's a ball.
it's a ball. What do you call that one, Kudos?
The balls.
You
This
have...
one.
You have
You
balls.
should know.
Itlog.
Balls.
Anda.
What?
Under the
Under the penis?
Only anda.
This is called the scrotum. Right?
Ah,
Yes.
Have you seen a scrotum?
Yeah.
Huh?
Ang bilis mo. Bilis mo.
So, ano na, what is na avulsion here?
Ano yan? Naputulan ng ano?
O, ano naputulan ng what?
Penis.
Parang tinuli.
Ng?
Parang
Ng penis, right? So, because of that, please check it under your seats. I have kept the penis there.
Yeah!
Ang maswerte makakuha mo nanalo na 5,000 pesos. So, in this case, guys, what do you do if your body parts has been removed
About pinaputi
or
na.
nakat? Accidentally, for example, okay, I was in an accident something, and then I cut my finger. Okay, there, you see my finger.
Ilagay sa ano?
Ah, open.
Ice.
So, yung finger ko nandun na sa, naiwan na yung finger
if
ko.
you want to survive your finger, you need
So, what do you do with the finger?
Put it in the ice.
Put it in the
Container
ice.
with the ice.
You
So,
want to survive.
take it and put it where?
In the
Container with the ice.
Container with ice. Ikaw, where will you put that one? In the picture frame.
Memory of.
Thanks.
Do you agree, Rose? Dapat ilagay sa cold na area.
Yeah.
yeah, to keep it.
Is it fresh? Ilagay mo sa cold na area. And then, what do you do?
Go to the doctor. Go to
So,
the
tools.
doctor.
Together with the patient, right?
Yeah.
Can they put it back?
Yes.
The doctor.
If, sir, if the nerves of that finger is still alive.
So, how do you keep this alive? Paano mo
Make
keep
it clean.
alive?
Make it clean. After the accident, clean it.
Clean it? So, brushan ko muna.
No, you need to go. You need to put something to press the.
Cover it with cloth and go to the doctor.
Ilagay sa yellow. You have to put it in a cold environment. So, maybe you put it in a plastic, and then the plastic, you put it in a area, like a bucket, where, or a, anong tawag doon? Yung parang siyang lagay ng ice ba? Tawag
Yeah.
doon?
Ice box.
Ice box na may cold na area. But don't directly put it on the ice. Okay, it has to be separated from the ice. So, you put it on a plastic bag, make a pillow, yung parang may hangin, may pillow, but put it in the environment na it's cold. Okay? Why? Why does it have to be cold?
So it will not die.
To maintain
So the blood
the freshness of the...
Yeah, so para ang mga ugat kasi natin, if it's or cold, is do like this, right? So if you do like that, then the blood will flow, so there will be no more oxygen. So at least, if your blood vessels are constricted, as much as possible, the blood is still intact, right? So it will still supply oxygen to that area as much as possible. But you have to go to the hospital as soon as possible time, right?
Yes.
Okay. Now, but don't put it in directly to the ice or in the freezer because you will not make sisig out of that, right?
No way.
What is this?
I'll show you.
Next is GWS or gunshot wound. So guys, if you look at this, the gunshot wounds, there are two wounds that you usually see. One is the entry point and one is the exit point. So if there's two wounds, the entry and the exit, where is the bullet?
It's inside.
Outside.
Put it outside.
No,
No.
it's outside because this.
Yeah.
Very good. But if naman you only have one wound, only the
It's
entry.
inside.
So where's the bullet?
Still
Inside.
inside your
It's
body.
inside, which is more critical, right?
Yes.
So you'd rather like see na it goes through your body because that means that the bullet is not inside your body. But what if there's no, so there's a tendency. Now, once the bullet touches the surface or a hard object or surface, and then once it touch there, then it will dislodge or dissolve, and then the powders are like, so maybe you will hit the nerves, and then internally you have a bleeding. So that's why a lot of people die of gunshot wounds. Okay. Now, next question: what do you do with the bullet? So once it's removed from the body, what do you do with the bullet?
Put it in the sterile
Report to the police.
Very good. You have to report it to the police. Okay. You don't throw it away. You have to report it. Okay. Next. Basa. Read. Tagalog.
Nasaksak.
What could make you saksak?
Panisong.
Huh?
Knife.
What else?
When you are
What happened to this girl?
Suicide?
No way.
Hold up.
Accident.
Hold on. This girl is actually wearing makeup while the is mobile. And then maybe there was a
May
sudden break or
eyeliner.
something, and then natusok siya bigla.
Yeah.
Okay? Penetration is nasaksak. How about this one?
Oh,
So
shit.
saan kaya ito nagtatrabaho?
Construction.
Sa construction, maybe they fall from the ano ba tawag doon yung mga ganun-ganun sa construction?
Pundasyon.
Oo, anong tawag doon? Saan sila nagka-climb, anong tawag doon? Iska!
Scaffolding.
Scaffolding.
Very good! Scaffolding. Scaffolding. So if you notice, guys, they did not remove the metal that this bakit? How about this one?
Kasi mag-flow yun.
What happens here?
Knife.
Knife? What could be the reason? Ano kaya, what's the story behind this person?
Fighting.
Ikaw, what's the story behind this? Anong chika dun sa K6?
Robbery?
Someone stabbed you.
Okay, ikaw naman, anong kwento mo dito? Ha?
Katangahan.
Ikaw.
Maybe,
Ano kaya yung reason bakit siya sinaksak?
maybe gumawa siya ng masama.
Ikaw, what could be the reason why he was stabbed?
Robbery?
Ha?
Robbery.
Robbery?
Yeah.
Tama, ikaw.
Yeah, fighting,
In
sir.
Africa.
Oo, gumawa ka naman sarili mong kwento. Ikaw.
Mahirap sir, napapahuli mo lang.
Nagpagkawan.
Tinagalog na.
So, now, if you're gonna go to the hospital, are you going to remove the knife?
Yes.
Yes. And then what happens to the bleeding?
Yeah, the blood will
So, do you like that?
No.
No. You need to
So,
put-
again, ang question ko, if there's a stab wound, okay, are you going to remove the material
No.
or the object?
Let
The doctor do
Let
it.
the doctor.
Mm. Tapos si Emilio, ha! Tinanggal niya ang kutsilyo.
Patay.
Tapos sabi niya, ay, wag pala dapat tanggalin ng kutsilyo, right?
Hindi
What
pala.
do you do? Diba? Paglagay mo ng gano'n, hindi mo na shoot dun sa wall, nandito mo na siya, mali! Tanggalin mo agad. Isaksak mo ulit, mali! Sige, isaksak mo naman, isaksak. So, anong gagawin mo, Emilio?
I will,
What will you do? Remove or not remove?
I will stab myself.
So, anong gagawin mo?
No, if I remove, I put some clothes to stop the blood.
Will that help? What do you think? Sagutin mo yan.
Yes? Speaking. I'm at school. I will call you later, okay?
Okay. What is puncture, Tagalog?
Natuso.
What could make you tuso? What could cause puncture?
Puncture.
No. No. What else?
Accident.
Yes. What could,
When you are walking in the
Puncture by
construction.
finger.
yes, maybe nails.
Yeah.
What else? Yes, what else? If you're stitching, then you puncture yourself with the needle, a long needle. What else?
Staple wire.
Staple wire.
Yeah.
So what do you notice about puncture and then penetration? Which one is deeper?
Nasaksak.
Penetration.
Yung puncture is just parang prick lang, right?
Yeah.
Yung parang a small ano lang. So siguro mga thumbtacks, mga stapler, yung mga nails or your pencil, mga ganyan. Okay? So, during your honeymoon, what was that? Penetration?
Penetration.
Or puncture?
Penetration.
Penetration. Yes, penetration. If it's deeper, that is.
Penetration.
If it's only like that,
Puncture.
very good. So, ikaw, anong experience mo? Just kidding. Complications in wound healing is hemorrhage. What is hemorrhage in normal tao? In normal person? What is hemorrhage?
Pagdurugo. Sabi sa pagdurugo.
Another term of hemorrhage.
Bleeding.
Perfect. In science, it's called
Hemorrhage.
hemorrhage. Okay, so from now on, you call this what?
Bleeding.
Hemorrhage.
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 So pag there's hemorrhage, what do you do?
I thought hemorrhage is just only for the head.
Get
I
a
thought
cloth
hemorrhage is
and
just only for the head.
Oh no, hemorrhage is bleeding in general. So bleeding in general, whatever area or body is that, it's called hemorrhage if there's too much blood that's being loose. Okay. So what do you do?
Because
Go to the doctor. Bring to the
No.
hospital.
get something to control the bleeding.
Okay.
get the alcohol and put.
No, alcohol, shot.
So
No,
you put
yes.
apply pressure. Can you say
Yes.
pressure 3 times?
Pressure.
Perfect. So ilagay mo yung pressure. Okay, you put something, I don't know, maybe a cloth, maybe a t-shirt or
Yeah.
whatever. However, you do not have gloves. Are you going to hold that bleeding part
No.
with your bare hands?
No.
No.
If it's
No, ikaw.
Because there might be-
Parang yes ka.
If myself, yes. If I don't have chance to
Get
No,
Yeah.
but if you're not it's not you that's ano ka lang, bystander, you happen to pass by. Hemorrhage, the person is hemorrhaging.
no, you don't have no. Not allowed to touch.
Why?
You don't
Because
have
you're
that.
not-
Cross-contamination.
Huh?
I don't know what she have kind of blood.
Maybe type O.
No,
No,
you're not
It's
considered.
blood, hepatitis blood. You don't
Okay,
know.
very good. Now in that case, what you can do is you have to teach the patient, okay? Here I have a cloth. I'll put this one here. Just get your hands and then push it hard so that the bleeding will stop, okay? Now, that handkerchief or that shirt is already full of blood. What do you do? Remove, get another cloth and then remove this and put, or put and then put.
Just
Put and put.
Put and put. Do you agree?
Yeah.
Iputang mo siya, ilagay mo siya on top.
Yes.
Or remove and then put.
No.
Just
Put and put.
Just
Ikaw.
Put and put.
Put. Yes, because once you remove that, and then the bleeding starts again, right? So put it there, then let it be, and then cover it on top, and then cover on top, cover on top, cover on top until you get some help from the emergency. Okay? Infection. So what are the signs and symptoms of infections? Signs and symptoms of infection.
Swollen.
Inflammation, there's a fever, what else? See, ano ba nangyayari dito?
Pass.
There's a presence of pus. Is there pain?
It
Yes. How about if I touch this? Is it hot or cold?
Hot.
Hot to touch, yes. And then, maybe there's some blood or bleeding also. Okay? Dehiscence is if the parts are not attaching. So, normally there's a suture here or tahi. But for some reason, since this is a complication, for some reason, it's not reattaching itself. Parang it just keeps on, parang silang pinagtagpo, pero
Pero di dinadhana.
hindi dinadhana. Okay, ito namang evisceration, lumabas yung mga laman sa, so there's an ostomy and then there's an evisceration. I'm done. Okay, next.